Hello and good day. My name is Zach Monahan. I'm going to be reviewing the paper Investigation in Sociodemographic Factors Associated with Caregiver Strain. My corresponding authors are student doctors Deanna Shores and Allison Mack, and doctors Natasha Bray and Micah Harwell. Some background: more than one-fifth of individuals in the United States are providing care for people with long-term disabilities. That number is only expected to increase with an aging population and with an increase in people living with chronic conditions. The strain is generally defined as an increased rate of depression or anxiety among people who are providing financial or physical support for other people. And this strain is often multifaceted, and that makes the effective establishment of social and educational support programs more difficult. This often yields a circular issue where caregivers may feel that they don't have support in the community or among their physicians, and that might yield increased rates of depression. Meta-analysis into caregivers does generally find that female caregivers, caregivers with low educational attainment, and caregivers who live with their care recipient are associated with higher scores on depression indices. Our objective is to further illuminate factors which may be associated with increased rates of depression among caregivers. We looked into demographic factors like sex and educational attainment, like the previous studies, and also factors such as income, ethnicity, and urbanicity. Our secondary question is whether the relationship between the caregiver and the care recipient, the disease or disability of the care recipient, or the type of care they provide is associated with high levels of depression among caregivers. Our methods are using the 2021 Behavioral Risk Factor Surveillance System, or BRFIS study conducted by the CDC every year. We include respondents in the study if they provide care for an individual, family member, or friend with long-term disability within the last 30 days, but have been doing so for greater than 30 days. That gave us a sample size of over 32,000, which represents over 17 million people in the United States. Demographic variables that we looked into were sex, ethnicity, income, educational attainment, and urbanicity, and additional factors we looked into were the relationship, the diagnosis of the care recipient, and the type of care that the caregiver provided. Here are our results in text form. I'll go to the next slide with a larger image. So we found significant correlations between race, sex, income, and educational attainment with increased rates of depression among caregivers. Namely, with ethnicity, we found that American Indians, Alaskan Natives, and those who marked others as a race had the highest rates of depression, and those who marked Asian or Black as a race had lowest rates of depression. With sex, we found that females had higher rates of depression compared to males, and with income, we found that the highest rates of depression among caregivers had the lowest income of less than $15,000, whereas those who made greater than $200,000 a year had the lowest rates at 11%. For educational attainment, we found that individuals, caregivers who did not graduate high school or who started college but did not finish had higher rates of depression compared to those who had graduated high school and did not continue to college or had graduated college. We found no significant difference in the rates of depression among caregivers based on urbanicity. Here are the factors based on the care recipient. If they were related to the caregiver as the mother-in-law or the wife, we found that that was associated with a lower rate of depression for the caregiver at 18.77% and 15% respectively, whereas the live-in partners and the grandparents of the caregivers, that was associated with a higher rate of depression for the caregiver. As for the health condition, we found that care recipients with infirmity or frailty had the lowest rates of depression, whereas those with asthma and mental illnesses had highest rates of depression. HIV and substance use disorders also had higher rates of depression for the caregiver, but these had very low sample sizes. And we found no significant difference in the rates of depression among caregivers who managed personal care or managed financial care. In conclusion, we agreed with previous research efforts that females and individuals with low income and educational attainment were associated with higher rates of depression. However, we found that there was no significant increase in depression among caregivers who were caring for individuals with dementia. And we also found a significant increase in depression among caregivers who were caring for people with mental illnesses or HIV. Further research into these risk factors can help establish more directed and personalized therapeutic approaches, which can in turn reduce the emotional distress placed on caregivers and mitigate the effects of this caregiver stress on the prognosis and quality of care for care recipients. Here are my references. Thank you for your time, and I look forward to answering questions on Research Day.